choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Hey, welcome back to the leading podcast about consumer-driven innovations in healthcare. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about Costco's new weight loss program. How is Costco's partnership with Sesame fueling this new offering? And what does it signal to us about the next pivot in consumer-led retail health services? I'll talk about that. Then Paul Schrimpf joins me once again for our special mini-series about the future of marketing. For our fourth episode in the series, we welcome Dave Hook, Executive Director of Marketing and Consumer Experience at John Muir Health. Dave shares how evolutions in payer mix, martech, and innovation are driving their approach to consumer-led healthcare. Anytime Paul joins the show, it gets next level, and Dave shares a ton of insights. So it's time to dive right in. Are you ready? Let's go.
Flava of the week.
Costco may be giving us a signal about the next pivot in consumer-led retail health offerings. USA Today reported that Costco now offers a weight loss program through Sesame, its healthcare marketplace partner. The service costs $179 every 3 months. You'll recall that it was just September 2023 when Costco first announced its primary care partnership with Sesame. Pricing for those services is competitive and transparent. $29 virtual visits and reduced cash pay pricing for mental health counseling and in-person visits and lab work where available. David Goldhill, Sesame's co-founder and CEO, recently told USA Today that the expansion into medical weight loss services came as a result of inquiries from patients. He said that the number one search term of Costco members seeking primary care on Sesame was around weight loss. So both parties got together about 2 months after the primary care doctor partnership started and began looking into offering weight loss management because that's what consumers were coming to them and asking for unprompted. So how does Costco's program work? For that $179 subscription fee, members receive 3 months of clinical consultation, the ability to select the clinician of their choice, an initial live video consult with the clinician, the ability to message their clinician outside of scheduled appointments, a nutritional guide and recommendations, and an individualized, clinically appropriate treatment program. I'm intrigued to say the least, and I have 3 questions. First, is this a signal of what primary care looks like to the masses? I find it fascinating that weight loss was the top search term related to primary care. Now, I'd love to know if that's unique to this particular partnership and if it tells us more about how people view the healthcare benefits that they get from a retailer as opposed to a primary care doctor. Second, is this the new funnel at scale? Meaning, can health systems follow suit and get into the business of weight loss as a service line and take this new direction as a way to start reclaiming the primary care funnel that retailers have been trying to take from them? And third, is retail health really closing its doors or just pivoting yet again? Because yes, I don't think retail health is just what happens at retail locations. I think it also refers to care that happens through any retail brand that consumers first know from outside of healthcare. So in my mind, this program definitely fits the bill. Now, as we look to answer these questions over the coming months and years, one differentiator that will likely drive the ultimate success of programs like this is the partnership aspect. Because going from zero healthcare services to primary care and now weight loss in less than a year shows us how quickly a retail partnership can accelerate consumer-driven care. And more importantly, it's a significant signal that shows how consumers think about their health and wellness. Let's pay attention to the intersection of primary care, retail, and weight loss, and be more innovative with new service lines that cross those boundaries. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, everyone, let's get into the flow. As I mentioned earlier, listen, this is part of our series that we're inviting Paul Schrimpf here. He's helping me co-host this mini-series about the future of marketing. Paul hosts the Microdosing podcast. He's a colleague and friend, and you've heard several episodes with him by now that if you haven't heard, I invite you to check out. We've had some really good conversations with folks everywhere from Kyle Smith from Noom, Shaylee Gupta at Mabel, Jamie Geyer at DexCare. really wide-ranging conversations, and we're excited to add to that today. But first and foremost, Paul, welcome back. What have you been up to lately?
No, I'm doing well. Great to be back. Kind of in the conference circuit, the spring conference circuit, but staying busy and having a lot of fun and catching up with a lot of friends.
Outstanding. Well, let's get right into our guest today. Please give it up for Dave Hook. Dave is the Executive Director of Marketing and Consumer Experience at John Muir Health. Dave, welcome in. Welcome to the Healthcare Wrap.
Thank you, Jared and Paul. I'm really pleased to be here today.
We promise we won't, double up on you. Our intent is to hit a few different topics from a few different angles, and we're really excited about this conversation. We always like to help our listeners get to know our guests a little bit better right at the beginning. Can you give us like a 2-minute description of who you are and what you do?
Sure. My name is David Hook, as you said. Thank you. And I'm Executive Director of Marketing and Consumer Experience at John Muir Health. John Muir Health is a health system in the East Bay of San Francisco, so think eastern suburbs. We have 2 acute care hospitals, an acute psychiatric hospital, urgent care centers, and a network of over 1,000 specialists and primary care physicians. So we try to provide complete care for your life from A to Z. I lead the marketing team, which includes both consumer marketing and physician marketing. So in addition to everything that comes to your head when you think of marketing, we also have a physician outreach or physician liaison team. I'm also leading the charge to better develop our consumer experience skill set at John Muir Health so we can deliver a better and more differentiated experience to our patients.
Fantastic. Okay, so that kind of answered where I would think of when we're addressing health systems, it's usually helping those outside of the health system ecosystem understand even, what the breadth and depth of things is, the offerings there. So that's very helpful actually in terms of the locations, the size and scope of things. What are some of the, areas of focus for the health system right now? This is kind of like right in the middle of that radar screen for you when you're talking about those big rock marketing priorities for you guys.
Sure. Well, like many health systems right now at this point in time, our first priority is strengthening our financial foundation, so contributing to the organization's financial strength so that we can continue to grow and be here for the community. And that presents its unique set of challenges, right? On top of that, it's blending the traditional marketing with consumer experience to continue to grow. So putting the financial discussion aside for a minute, we've been on this trajectory of bringing the 2 disciplines together, again, to better differentiate and bring new lives to our health system.
Very nice.
I think that's great. But I think the other piece that's worth noting is a system like John Muir Health shares a lot of similarities with most systems in the U.S. I mean, normally we think of like most patients and the systems they see, and we kind of get to a list of like 20 giant systems. But the majority of health systems are out there are usually 1 or 2 hospitals, maybe a couple urgent care locations in a very defined geography, which makes it hard, but in many ways it might be making it easier, Dave. And I'd love to get your thoughts on this, is because there's a little bit more of geographic definition around your footprint, which is only similar to, I think, New York, where you've got bridges and tunnels and hard geographic borders. Are you able to target your population easier? How do you think about payer mix? Is there anything that you think is more of an advantage because you're more geographically bound, if that makes sense?
Well, I think with the evolution of technology, geography is actually less important, especially in the Bay Area, where you have, in general, base that is very tech savvy, that wants to use tech. And this is the national trend too, right? And the pandemic kind of jump-started this movement toward digital health. And even putting that aside, in our daily lives, when we use the Amazons and the Netflix, we just expect that, right? So it's less about where you are, and it's more about how do I access the services that I need and the benefits that I need easily. And if I can do that quickly and easily through a digital channel, great. If I need to go in face to face, of course, that needs to be convenient if it's something like urgent care or primary care. But given the advent of digital health, I think geography is less important than it used to be. It used to be you had to be down the road, right? not so much anymore.
That's a good call out, because the other thing that's always fascinating to talk about is the work-life roles, is where you live and where you work are sometimes different areas of the metro area. So if you have tighter footprint, your population might be, in this case, Walnut Creek in the evenings and weekends, but it might be downtown San Francisco during the day. And that digital connection is what you need to be riding in there, because to assume that people are in the same neighborhood every day, every hour is a bit naive.
Sure. And, where I guess geography does come into play, this is kind of a different slant on the conversation. We have our partnerships with UCSF Health, building a cancer network. And when it comes to cancer care and people are, frequently needing an in-person experience, being able to offer them an access point in the East Bay through John Muir Health is really an advantage.
Yeah, and I'd love to have you speak a little bit more about how you think about your partnerships, because I think that's something that John Muir Health does a very good job of, is recognizing that you're not the only player in town, because I'd contrast that with my other friends in health systems where they make the wrong assumption that a patient comes to the same building for all their care needs. And that's just not true. There's physician groups, there's partnerships with pediatrics, but talk a little bit more about how your role needs to kind of mesh and complement your peers at some of these other organizations.
I think it depends on what type of healthcare we're talking about. I've seen this over the years in our research, right? If you're talking to a mom about everyday healthcare for her kids, she wants it to be convenient. She wants to go to one place where she can get everything in one building. I don't want to run all over town, right? Hopefully get everything done in one day. So the everyday healthcare kind of thing, I think, is one mindset and one dynamic. And then when it comes to specialty care, the more serious stuff, that's a different dynamic. In that case, people want and really appreciate the partnership between John Muir Health and UCSF, for example, bringing expertise of both organizations together, giving our patients access to more clinical trials, and making that available to them, in this case, down the road. If they have to go in for an infusion every day, they don't want to drive across the bridge into San Francisco. They would rather, again, go down the street. So it's interesting. It depends on what part of healthcare we're focusing on, right, for certain conversations.
For sure.
Does it feel unique to be addressing consumer marketing and physician marketing, or is that more commonplace than maybe I'm realizing?
To me, it's just applying our marketing skills and training to this industry. Although I will say, since I've been in the industry, I've seen an evolution where what it used to be is, let's tell everybody we can about what we do and how great we are. Those of us with marketing training would go about that differently, right? Who are our customer segments? How should we segment our customer segments? What do they need and how do we deliver it? Who's really making the buying decision? Where does the volume come from? And again, I think this is where this almost two different worlds that I just mentioned comes into play. When we talk about everyday healthcare, primary care, urgent care, it's the mom making the decision. Research will show that when it comes to things like cancer care and cardiovascular care, sure, people are becoming more engaged and involved, but it's still by and large a physician who refers the patient in to us and patients following their physician referrals. So we can put up a lot of advertising, but for some of these specialties, the patient's going to follow what the physician recommends. And so we want to make sure that we're communicating to our referring physicians as customers and understand what their pain points are and what they need to know and how we can help them provide better care to their patients, hopefully through John Muir Health. But at the end of the day, they need to make the right clinical decision.
Those are good call outs. And I usually use retail care, which is not the best term for it, but routine, less intimidating. But when you go into more complex, there is a heavier reliance on physicians. And while we are saying we've got more consumerism in healthcare than ever before, patients have more access to information than ever before, but we always go back to those personal stories. So like when my son got diagnosed with epilepsy, yes, I can go to any pediatric neurologist I want to, and I can do my own research, but I'm still not a neurologist. I don't know how to judge a neurologist. So I'm very reliant on physicians, physician referrals, and other physicians vouching for other people as a way to make my decision. And I think that's always true, particularly in more of the rare and or complex conditions, as you mentioned. Those are good calls.
Maybe when we talk about consumerism as it relates to these more complex types of care, maybe we need to think more longitudinally about a journey and focus less on who makes the decision. Because even though you might follow your physician's recommendation, there's this ongoing experience that in your mind is going to be colored by the experience you have in other industries. So yeah, I'm experiencing that right now, right? With my family, it's, gee, this is so complicated and so complex. Why can't this be easier? I mentioned that app idea earlier. Why can't there be an app that does this or that? So it's not that we're making the decisions about the specialist per se, but we're riding along in this journey, and our expectations for a seamless journey or an easy journey or a convenient journey are colored by the experiences we have elsewhere in our lives. And those expectations are increasing, or our tolerance level is decreasing. I'm not sure which it is. Maybe it's both.
Yeah. That helps set the stage for, now, how do we address this? How do we tackle all these things? And I think Paul and I have both been riffing lately and just thinking about how martech fits into that, how it's evolved recently and how it seems to be at this inflection point. I think the term we heard when Jamie was on, Jamie Geyer, was that there's like 13,000 martech tools and platforms out there. So are there some that are just like, these are ones we have to be using?
I have to be honest and say I haven't come up with a definitive list yet. And here's why. The silver lining, I think, to the pandemic, if there could be a silver lining, is that it kind of jump-started this movement toward digital health and healthcare, and this explosion in investment in shiny objects. And so there are so many out there right now that as a marketer, it can sometimes be daunting to kind of think of all the possibilities, be awed by all these shiny objects, and think about, I got to have all these things. But what is becoming more and more important is integration with other systems at John Muir Health or whatever health system you work for, right? Because if it's not integrated, it's not going to provide a seamless journey, number one. And number two, it's probably going to have to be integrated with the medical record at some point. I mean, there's some basic tools that I would say, CRM, in the future, a CDP, sure. But I'm thinking that less and less do I want to be in the position of saying, I want this technology from this vendor, and I want to stay grounded in what is the experience I need to deliver, I want to deliver, and how does that make it easier and better for the patient, and work with my IT experts and have them help me say, then you need this and this and this technology solution, and here's how it fits into the bigger picture.
That's very appropriate too. I mean, I appreciate that, because it's first and foremost just how much it changes, but secondly, the recognition that the needs are evolving for what you actually have to get done here. I know Paul wanted to dive into a little bit about what that means for designing your team and your long-term plans. Paul, did you have a question regarding that?
It's definitely in that space, because I think, Dave, where you were going, which is the integration piece, which always go to handoffs. And handoffs has always been a key piece of John Muir's experience, which then goes into the world of Dave and then obviously your team, because you're not just the head of marketing, you're also in charge of experience. But would love for you to talk a little bit more about why that's such an intuitive combination and how that guides kind of the team around you.
Maybe I oversimplified in my brain, Paul. To me, consumerism is another label for what I was trained to do in marketing. It's understanding your customer and how to deliver that value or that benefit. It's just that in today's world, it is about the experience. It's less about the big ads, But to me, I mean, I suppose we could make a distinction, but if they weren't the same, they are the same now. And I would throw technology or martech in there. I see those as, three circles converging in a Venn diagram. That to me is the definition of marketing in today's world. And so, the question of how does that affect my team? It means we need to offer them the training. If we bring on a new staff person today, this is probably the world they grew up in, and it's just natural for those of us who have been around the block. It means learning new skills. And, I think we as leaders owe it to our teams to give them these skills, to train them, to ask them, to push them, because they're going to be the leaders of tomorrow. So what's new to us today is going to be old hat to them tomorrow. And we need to think about giving them the skills to help us today, but also to grow in their careers.
Those are good points. I think that's the one that comes up quite a bit and you've been hitting on this consistently in this conversation, it's foolish for us to go to marketing into like some simplified funnel of like awareness, consideration. And we'll often hear in the hallways of executive wings going, we want to be known for XYZ. But what we were touching on in a couple spots earlier is sometimes we don't need to be known. We just need to be there when it matters. So if you have an unplanned event, you better have a darn good SEO strategy when somebody's looking for an ER or being to access. But you don't need to have a billboard saying, for your next emergency, come to our ER. You need to actually be present in a digital experience. That might not be an ad, but it will still be part of marketing in a lot of your search engine optimization. But is that kind of what you're hinting at if I was to put some additional fidelity on that?
Word of mouth, whether that's me speaking to you or going online, digital word of mouth is still king in healthcare. It is, the ads can help with awareness. Gee, I've heard of that place before and, I have a good feeling. But yeah, when it comes down to even choosing your primary care doctor or your pediatrician, it's going to be word of mouth. And whether you get that from your neighbor over the fence or through, Google or Yelp or whatever, that's king.
It does make sense for systems that have a major strategy in orthopedics, which has a pairing with sports medicine, which is what the people in the business would call it the front door. The brand association with athletics, orthopedics, because there's a high volume of patients that come into systems with a sprained ankle or shin splint.
I think with sponsorships, with probably any marketing strategy and tactic, to a large degree, it's really dependent on your organization's specific challenges and strategies. What works for one doesn't always work for another.
When you've seen one health system, you've seen one health system. That's very true, especially the constraints, the team makeup and so forth, and their market, quite frankly. So I know I keep injecting the tech side of things in here, but I'm definitely curious here, Dave, because we hear so much about it. And it's one of those things that I don't know if we will get to a point where there's consensus, and that's fine. And I'm talking about AI just in general from a marketing standpoint, whether that's certain tools that maybe you've tried or just a general philosophy about it, about where it is and whether, what types of tools are making sense for your team to explore at this point. But just in general, what's your temperature on AI? And from a marketing standpoint, what do marketers really need to know about it right now?
This is a good example of I can only speak for myself and my team at John Muir Health. AI is quickly shooting to the top of the to-do list in terms of, if you think of a learning curve, right? I am beginning my learning curve here, and I'm encouraging my team to do the same. I'm really intrigued for the possibilities that it offers to provide that personalized experience that we've wanted and have as our vision. I'm also increasingly intrigued by using it to help us go further, faster, better, and cheaper with a small team. And this is, what I was kind of alluding to earlier. We're small. How do we get the most firepower from the resources that we have? Well, AI might be a tool to help us here to get that web copy written faster, to develop creative faster. I don't know. This is kind of where I want to explore. I think the simple way I would summarize it today, I heard a great quote in an AI conversation the other day. AI won't take our jobs. Someone who knows how to use AI will take our jobs.
I don't want to scare too many of my marketing friends out there, but I think most marketing teams can run with less. So if you have already a small team, you can get more out of them now. If you have an oversized team, you might have too many. But what used to take the work of a junior marketer or a junior resource on the agency side is being replaced by AI. I mean, Jasper AI is a platform that will generate a bunch of ads for you immediately. Are they great? Not really, but so's the average junior resource making those ads at the time. They need to upgrade.
Gets you to step one faster.
For those that are overwhelmed and don't know where to start, I think there's also, you don't need to worry about AI yourself, but you should be looking at the tools that you're using, whether that's Salesforce, Adobe, or your vendors. How are they using AI is a practical way to get started, because a lot of those platforms are going to be doing a lot more than they did before. And we don't have to understand how it works. If it just makes it better and easier, we just need to use it more often.
Which is funny, because that's the thing that surfaces every few years whenever whatever new technology is out there. Is it going to take my job? That's the number one question.
I still want to meet those people going, oh my gosh, I'm really scared about the computer taking my job. I mean, what routine, low value job do you have? Because most of us think we're doing high value intellectual stuff, but they must be out there. Dave, John Muir Health has a really good strategic partnership with Optum. And is there anything in that Optum relationship that brings a little bit more of an advantage to you doing your job, or how you can get more out of them in your space?
Well, it certainly brings additional, I'll call it intellectual and analytical firepower, Paul. And that's one of the reasons that we entered into this partnership with Optum. So when we think about data analytics, thinking through these technologies, martech, AI, they're a great partner to provide scale in thinking and moving forward.
I've always liked the clarity of John Muir Health's strategy around what we are and what we're not, because I think too many health systems aren't really clear on their swim lane and they try to do everything. And I had a chance to talk to Adam Paetzer of Vital AI a while back, who helped started Mint.com and ran Intuit for a while. But he's like, I remember going to my first health system and looking at their server room and going, why do you have a server room? You're not Google. You're not Amazon. Why are you trying to be an IT company when your core competency is care? And I think John Muir has always done that well, which is we're going to be great at delivering care in communities, but we're going to use a UCSS partnership for complex care. We're going to use Optum to run management. But I think there's some really good insights there that others who are listening can take, which is what are we going to be great at and what are we going to use others to be great at, and being clear on that. There wasn't a question there, but just would be curious if you got any builds to that.
Sure. And coming at this from a marketing point of view at John Muir Health, something I'm very proud of, and Paul, you and I worked on this many years ago, we developed a very strong, insight-grounded brand strategy and brand positioning. And that has become so core to our DNA, so core to who we are. I think that's been the consistent North Star, or one of the consistent North Stars in everything we do, from a strategy down to a communications, down to an operations, down to the frontline nurse point of view. And so when I now take that to heart in this conversation and going forward, sifting through all these technologies, sifting through AI, how does it help me deliver on that brand promise to our patients and consumers, and even to our physicians, because we use that brand promise with our physicians as well. It's very simple, right? But it's now cultural. It's the who we are. And I think that's what keeps us grounded and uniquely John Muir Health.
Dave, this has been very insightful. I wonder if there's anything else that we haven't mentioned that you think would be useful for those who want to know kind of what to keep in mind from a marketing standpoint in healthcare right now.
What comes to mind for me, and I have to thank you guys too for helping me kind of crystallize this in my head. Marketing is now about the convergence of marketing and technology and consumer experience. But I want to stay grounded as a marketer. There's going to be all these shiny objects. There's so much to learn in technology. There's so much to learn in AI. And I think that's now part of our job to learn what those things can do. But at the end of the day, I think we need to stay grounded on, but what is the benefit we're trying to deliver to our consumers and to our patients and our physicians, and keep the anchor there and use that as a filter, because this can also become really complex. And at the end of the day, for the most part, people don't want to use healthcare. It's something they have to do. And when they have to do it, a lot of times they're in a lot of distress and pain and they're not feeling well. So how do we in marketing make that experience, those touch points, easier, more convenient, less distressful, so that the caregivers can shine? Because really, it's that human, how paradoxical, right? When we're talking about technology, it's the face-to-face human interaction in healthcare that's so cherished and so dear. So how do we make the rest of the experience as convenient, as easy, as frictionless as possible, maybe even invisible? One way to do that is just to keep it simple. And so the risk we have with all this technology, it can easily get more complex. We're in the right place to keep it simple, right?
I'm liking that theme pick up more steam. And there was a conversation, a colleague of mine, Jeff Gorgie, had with Matt Gov, formerly of Piedmont out of Atlanta. And Jeff asked Matt, it's like, how do you go about building a relationship with your patients. He goes, that's the thing. I'm not trying to build a relationship. I'm trying to make it quick and easy or make it more accessible. And I think that's where we're starting to see a big title shift is this precious, you have to have a relationship with your provider, big P and little p. And that's what it's about, to where how do you make accessing care easy, convenient, and accessible is actually a new idea in healthcare, but it's great to hear you leaning into that and as well at John Muir Health.
Paul, any other final thoughts from you?
I always have to lob in my favorite closing question, which is, Dave, you've been at John Muir Health for about 16 years, but if you were to go back to, say, when you were at San Mateo Medical Center and give yourself one piece of advice, what would you tell yourself?
Stay true to the patient and the consumer. And that's why we're in marketing, right? That's what we're trained to do as marketers, but stay true.
Excellent advice. Simple, to the point.
That's a perfect place for us to wrap up here. Then we want to thank you so much for giving us a lot to think about today. We've had the absolute pleasure of speaking with Dave Hook from John Muir Health. Thanks so much for joining us.
Thank you.
Thanks for tuning in. If you like what you heard, please spread the word. Tell your colleagues to tune in for all the awesomeness, then leave a review on Apple, Spotify, or wherever you listen. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. See our full lineup at shiftforwardhealth.com. One subscription, all the podcasts you need, and it's all for free. And remember, we might have a lot of work to do in healthcare, but we'll get there faster together. Thanks again.